Good evening, students. I am Dr. Shivamurthy. I am going to continue the last class where I was discussing about various routes of drug administration. In the last class, we discussed about what are the different routes of drug administration available, how routes of drug administration is chosen. So please go back and visit my earlier video before listening to this video. Okay, so now let us discuss about different types of local routes of administration. I would like to tell you that I'm going to discuss three different local routes of administration. Okay, let me just tell you how this is going to be helpful for our future discussion and also for therapeutics. I would like to tell you that local routes of administration is a very important route of administration because most importantly, drug reaches the site of action immediately without needing any systemic absorption. It will bypass the liver, it bypasses the first pass metabolism, it bypasses all different difficulties to reach the site of action. So in this way, this route is very important. And also in this local route, you can, especially when you apply over skin and mucous membrane, if there are any adverse drug reactions like irritation, itching, or any kind of issues noticed, immediately you can take actions by washing the local area and cleaning the area, and you can remove the drug from that site immediately. So in that way, that is another advantage. So next one is that you don't require to give higher concentration of the drug. If you can make the concentration which is sufficient to reach the or apply over local surfaces or local tissues, then it must be sufficient. And since it is not reaching the systemic circulations, it may not affect the various other organs that we are getting exposed in systemic circulation, systemic drug administration. So in this way, local route of administration is very important. Another important thing is that in local route of administration, you can terminate the action of the drug immediately once you achieve the sufficient response. So that is the another advantage of this local administration. And in local administration, you will be able to see that the response is coming or not, whether the patient is responding or not. That also you can see easily. So you will be able to measure the response in a better way. And there are some local applications we may use for affecting the deeper tissues. Sometimes you may find it difficult to reach the deeper tissues. So that is one of the problems what we observe in local route of administration. There are sometimes some occasions where some patients are not able to tolerate the local application because their skin is not, the conditions are not favorable because they may be, and like once you apply, you have to keep it dry, clean, neat, and you have to cover it. So some areas, like you may not be apply because patient may be working in different areas in their working place, and especially if it is to be applied on the right hand and fingers, then it may affect the functions of the person, and the function of that particular part of the body may be affected for a few days. So it's not a major problem, so patients can easily adjust for few days till the issue is resolved. Now let us try to understand what are the different kinds of local routes of administrations available. So in the local route of administration, you have topical application. Topical application means application of a medicament or a medical formulations over the surface. Okay, and it is expected to produce the action locally only, and we don't expect the drugs to get into the systemic circulation. One is, even if it gets absorbed into the systemic circulation, it reaches less concentration because the formulation is prepared in such a way that it does not reach the systemic circulation. And also, the drugs are chosen in such a way that they are not suitable for the systemic absorption. So the one, either it is larger molecule or it is a different salt which does not get absorbed, or it is prepared in such a way that it does not get absorbed. That is also there. And also, we don't expect the drug to get into the systemic circulation, especially when you are trying to apply over topical applications. Now, in the local routes of administrations, topical applications, you can see that the skin is the most important organ, even though it is the largest organ in the body, and the surface area is larger, so that's an advantage also. So you can apply, and what I see that like the skin formulations are very costlier. That is the one disadvantage. I don't know why. So they are so costlier, but they are costlier. Next route is mucous membranes. Again, what are the mucous membranes we have here? Mouth, pharynx, eye, ear, nose, GIT, bronchi, urethra, vagina, anal canal. So these are the some of the mucous membranes we have on our body, inside our body. So here you may be knowing that mouth is an important area. Mouth ulcers are very common, so we apply some local anesthetic and also some local antiseptic agents for mouth ulcers and all, especially. Then pharynx is is the one, it is a kind of gate which protects us. And again, in pharynx you have tonsils and adenoid glands and other important organs, and there a lot of ulcers can happen due to many reasons. So again, we can have some lotions, like some kind of so we can have mouth washes and sprays for treating the pharynx related any diseases. Then eye, ear, nose, so obviously we'll use drops. Okay, so drops can be easily used, or and then GIT. Again, how GIT, how it can be used as a local route. See here, in GIT, even though it is one of the most important system that is used for systemic absorption, we can also use GIT for local route of administration also, especially some of the important diseases like ulcerative colitis, and also some inflammatory bowel diseases. In those cases, the problem is locally in the GIT, especially colon, small intestine, and all. In those cases, we will give some drugs which are not absorbed, especially sulfasalazine. Okay, sulfasalazine we give locally, and it affects, and it produces the anti-inflammatory activity at the GIT. And also we have colistin, which is also used for the local action, and some anti-worm, that is the anti-helminthic drugs we can give locally so that they don't get absorbed. Okay, we don't want them, especially albendazole, mebendazole. We don't want them to get into systemic circulation. So we want them to act locally and kill the worms, and they are thrown out of our body. So like this. And again, bronchi, how we are going to use. There are two important methods we can apply bronchial route of administration of the drug. So one is that like we give general anesthetic. It is a systemic route of administration, but we can treat bronchial asthma and chronic obstructive pulmonary diseases with local administration of spray or inhalation route can be used for treating bronchial asthma and COPD with ipratropium bromide, and we have corticosteroids, budesonide, of so many corticosteroids are there, so we can give through inhalation route. And again, urethra. So urethra is the another important area, especially. So we can use this route for like a urinary route for treating the gallbladder, and also local urethra infections can be treated. And vagina is the another important route of administration, especially local intravaginal tablets and creams are available, especially to affect the local area infections and fungal infections or bacterial infections, parasitic infections can be treated. Again, anal route is the another important application we can give, especially like if any local issues are there in through the anal canal, so there also we can give some suppositories can be kept there. Then so just to highlight what are the different kinds of formulations available, you can see here ointment specially applied for the skin, cream again applied for skin, and then paste again applied for the mouth, like you can use for cleaning the teeth. Pastes are available, and also skin also we can apply. Lotions, again lotions applied for treating many parasitic infections locally overhead. Then powders can be applied. Powders can be variety antifungal powder, or for heat, pricky heat we can use powders, and may smoothen the area, surface area you can use. Then gargles, especially for the mouth, teeth, and pharynx, we can go for mouthwashes again for the mouth. And sprays are available. Sprays can be applied over the skin, over the mucosa. Varieties of places you can go for sprays, and suppositories are also, and tablets also. Like as I talked about the GIT, so the drug will go to GIT and then they affect locally. Next one is deeper tissues and cavities. Here, I think this is another important route of, especially local route of administration. Wherever, we have so many cavities in our body, and if there are, they are also difficult to, reach those places also. These intra spinal or, varieties of spaces are there, joint, arthritis. So there also, a lot of cavities are there. They are difficult to reach. So we can use some syringes and needles for reaching those sites. So they produce one. We don't expect the drug to get absorbed from there, especially bone marrow. So it's difficult to reach there, and also from there also to go out also it is difficult. So produces localized action in the deeper tissues. Okay. So we don't expect any systemic absorption from these deeper tissues. So only minimal may be absorbed, but we may not expect any absorption systemically. So as I said, intra articular hydrocortisone acetate injections in the knee can be easily given, and infiltration around a nerve like using needles, local anesthesia can be given. You can see here intra joint, the intra-articular administration of the articular hydrocortisone acetate is there. Here you can see the mandibular nerve is paralyzed with the help of lidocaine injection, and again you can see retrobulbar injections are done with the help of hydrocortisone. So hydrocortisone, so that is also there. It's going on. So like this. So now you can see here arterial supply. Arterials are so intra-arterial injections are the another important way to reach the cavities, like angiography. To do the angiography, we can use this is again local cardiac. Then anti-cancer drugs can be given to varieties of tissues by injections locally. So intrapleural route of administration can be given to reach some of the cancers, and then intra-tumor route can be used for reaching that particular route, and then intra-arterial route can be used to reach some of the important sites, as you can see here. And then intrathecal, so here you can see that like you are reaching the base of brain, and also some of the spinal cord you can reach, and you can see here some of the GIT areas, intraperitoneal route. Okay, so we can reach out to all these places. So these are cavities. They are difficult to reach, but still we can use some of these techniques for reaching those areas. So now in the next class, I'm going to discuss about systemic routes of administration. So till then, bye. Okay, so thank you very much for joining the class. So I will continue the class with systemic route of administration. And again, so in this class, I hope you enjoyed listening to local routes of administration and their advantages. And what are the disadvantages of local routes of administration? I think I discussed that there are only limited applications. We cannot reach out to systemic route in many cases. There are transdermal route of administrations are available. I'm going to discuss that later. So there are patches are available for treating withdrawal of smoking or withdrawal of some of the drugs. We can go for these the transdermal route of administration. Like that, we can go for like we can use the local route for reaching the systemic places. That's a different story altogether. So I'll come back to that. Otherwise, if you have any other questions, how this will be questioned or how this will be asked in your examination, I just want to give you that. Okay, so local routes of administration is an important one, and you may be asked to give, like describe what is local route of administration, and what are the different types of local routes of administration. You may be asked the viva, and you will be asked what are the different kind of formulations are available for the local route of administration, and in spotters you may get some of these, and what are the advantages, disadvantages, you may be asked. So with this, I believe that I was able to do some justice for this local route of administration. Hope you enjoyed this, and looking forward to see you again in the systemic route of administration. Best wishes, all the best. I am Dr. Shivamurthy N.